Charity Dingle reaches a devastating low in upcoming Emmerdale episodes after becoming the victim of a horrifying assault by Dr. Todd. Overwhelmed by trauma, she begins relying on alcohol and medication in an attempt to escape her emotional pain. Unable to come to terms with what has happened, Charity keeps the ordeal hidden and refuses to open up to those closest to her. Although she remains silent, her loved ones quickly realize that something is deeply wrong and encourage her to seek professional support. The question remains whether she will finally reveal the truth or continue spiraling into darkness. According to sources, Charity has faced many difficult challenges in the past, but this latest ordeal has shaken her to the core. Determined not to spoil Sarah's happiness surrounding the baby, she chooses not to reveal what Dr. Todd has done. However, keeping such a painful secret becomes increasingly difficult as the emotional burden grows heavier. Although Charity eventually finds the strength to report the assault, her nightmare is far from over. With nobody aware of the full story, she continues to suffer in silence. When her husband notices her increasingly unpredictable behavior, Charity invents an explanation rather than tell him the truth. During a visit to the doctor, she allows the assumption that she may be experiencing postnatal depression to stand unchallenged. As a result, she is prescribed medication, but the decision leaves her feeling guilty for misleading a healthcare professional and deepening her web of lies. Later, her husband expresses hope that the diagnosis will mark the beginning of her recovery. However, a conversation between them soon makes her emotional state even worse. In an effort to help, he has already sought advice from friends and family, but when he admits that he has discussed her struggles with Sarah, Charity reacts angrily. The revelation leaves her devastated because Sarah is the last person she wants involved. Already burdened by guilt over keeping secrets about baby Layla's true parentage, Charity fears that exposing Dr. Todd's actions could unravel everything and threaten the stability of Sarah and Jacob's family. Trying not to raise further suspicion, Charity waits until she is alone before breaking down emotionally. Struggling to cope with the trauma she has buried inside, she turns to sleeping tablets and wine, putting both her mental and physical well-being at risk. Concerned about her grandmother, Sarah reaches out and confesses that she feels responsible for Charity's suffering. She believes that if she had never asked Charity to be her surrogate, none of this would have happened. Heartbroken that Sarah is blaming herself, Charity decides she must reassure her granddaughter. Yet when the moment arrives to tell the truth, she finds herself unable to say the words. For a brief instant, it seems she may finally open up, but instead she dismisses her struggles as exhaustion, hormones, and lack of sleep. While hinting that there is more behind her distress, she insists that Sarah is not to blame. Even after steering Sarah away from the truth, Charity's guilt only intensifies. By continuing to hide her pain, she feels increasingly isolated and worries that she is pushing her family away. Meanwhile, Sarah breaks down in tears while talking to Charity's husband, expressing regret over the complications that the surrogacy arrangement has caused. Left alone with her suffering, Charity sees no clear escape from the despair consuming her life. As everything around her begins to crumble, the question remains whether Dr. Todd's crime will ever be exposed. Kane Dingle faces another devastating challenge next week after receiving troubling news about his cancer, shortly after an embarrassing incident leaves him shaken. During a hospital appointment, a consultant informs Kane and Moira that follow-up tests from his recent operation have revealed the cancer has spread further. As a result, he will require additional treatment. The specialist explains that before any new treatment can begin, Kane must wait several months to fully recover from his previous surgery. The overwhelming reality of what lies ahead proves difficult for him to accept. Like any cancer patient, Kane was desperately hoping to hear that he was free of the disease, an insider reveals. Instead, he's told that more treatment is necessary. Although the consultant stresses that the operation was successful, Kane can't stop thinking about the uncertainty of the future and the challenges still ahead. According to the source, nothing anyone says seems capable of easing his fears. It took considerable persuasion from those closest to him to undergo surgery in the first place, making this latest setback even harder to process as he weighs up what comes next. At the same time, Kane is struggling with symptoms that leave him feeling vulnerable and insecure, despite reassurances that they do not diminish who he is. His concerns intensify when he attends an event to watch his son become an army cadet. Just as the ceremony begins, Kane suddenly rushes away. Unaware of the reason, his son is left confused while Kane hides in the Woolpack toilets after suffering an accident that leaves a visible wet patch on his clothes. Fortunately, Charles notices what has happened and, together with Bob, helps him by finding a change of clothing. Even so, the experience reinforces Kane's fears that his health problems are becoming impossible to ignore. For someone like Kane, the thought that these symptoms could become a permanent part of everyday life is extremely difficult to accept, the insider explains. When the consultant confirms that this is a possibility, it leaves him feeling even more distressed. As Moira does everything she can to support him, Kane finds himself sinking deeper into isolation. With another major hurdle standing in his way, he must decide whether he can summon the strength to keep fighting and accept the support being offered to him. Dingle faces another difficult setback in Emmerdale, as an embarrassing accident leaves him struggling emotionally following his recent surgery. Ever since the operation, Kane has found it hard to accept the physical changes he has experienced. Before undergoing the procedure, he had serious concerns about the potential side effects, including losing sexual function and problems with bladder control. Those fears seemed to come true when he woke up after surgery and discovered he had a catheter fitted. Believing it would be permanent, Kane was devastated, and it took time for him to accept that it was only a temporary measure. However, once the catheter was removed, a new challenge emerged. Kane began suffering from an overwhelming and sudden need to urinate, which previously landed him in trouble after he was caught relieving himself in public. To make matters worse, he also experienced an accident that left him humiliated. The ordeal left Kane anxious about being too far away from a toilet, causing him to lose confidence and avoid returning to work. Just as he starts adapting to his new reality, another upsetting incident shakes him. Kyle is delighted when Kane agrees to attend his Army cadet swearing-in ceremony. Proudly taking his oath, Kyle is pleased to know his father is there to support him. But when he looks across the room, Kane has mysteriously disappeared. Although it appears Kane has abandoned the event, the truth is far different. A sudden and urgent need to find a toilet forces him to leave in a hurry. Rushing into the Woolpack toilets, Kane is horrified to discover a wet patch on his trousers. Mortified by the situation, he hides away in embarrassment. When Charles enters the restroom, he quickly realizes what has happened and later returns with a fresh pair of trousers to help him out. Together, Charles and Bob offer reassurance and support, promising to keep the incident private. In a significant moment, Kane reluctantly accepts their help instead of trying to handle everything on his own. With their encouragement, he returns to the ceremony and apologizes to Kyle for missing part of the occasion. Thankfully, Kyle understands and reassures his father that there is nothing to worry about. Even so, Kane is left feeling exhausted and defeated, wondering how much longer he will have to cope with the ongoing effects of his illness and treatment. Emmerdale airs on weeknights at 8 p.m. on ITV1 and is also available to stream on ITVX.